Hi, MAMCA members. It's Jen Hurley, membership chair, amongst other things, here to talk to you a little bit about the Medicare opt-out option. I've had many members email me and chat with me on our coffee hours about what is the process for opting out of Medicare now that we can enroll as covered providers. What if we decide not to do that? And so today we're going to have a quick MAMCA chat about what that process is so that I can give you a few tips and a few resources to help you along your way. First of all, we have to acknowledge what a big deal it is that we now can be included as providers for Medicare. This is a big win for our profession, of course. It will help us with workforce development, and it will help also with barriers to care for a lot of individuals in need of mental health services. But of course, if you yourself choose not to be a Medicare provider, based on perhaps not being able to support these clients, or perhaps that you only do private contracts, this slideshow is for you. Couple of things. This went into effect in January of 2024. So this year is the first year that we can be providers or opt out either way. And in the language of Medicare, we are considered MHCs, which makes sense. But across different states, of course, we have different titles. So just so that you know, anywhere you see MHC in the Medicare language world, that refers to us. Outpatient LMHCs in Massachusetts will be falling under Part B providers. Part A usually refers to inpatient services. There are other parts covered under Medicare, but we ourselves in outpatient services, whether you're an individual or group practice, you would fall under a Part B provider. So just as a note, this is a federal program. So they have also defined what a mental health counselor is. Our particular license covers the requirements by Medicare, but I'm going to review real quick what that looks like in case you've moved from out of state. Or just for additional clarification on what the federal program considers an LMHC to be. So here it is on my screen for you. Here are the three requirements. You have to be eligible for these three requirements to either enroll in Medicare or opt out of it. So just so that you know, you must possess a master's or doctor's degree, which would qualify you for licensure in the state that you are providing services. In addition, you need at least 2 years or 3,000 hours of post-master's degree clinical supervised experience in mental health counseling in an appropriate setting, such as a hospital, SNF, private practice, or clinic. So that is identified here as well. So if you're coming in from another state most recently and you don't meet those hours, you might want to look at that for your eligibility. In addition, you must be licensed as a mental health counselor in the state which you're performing services. So just please note that this does not apply if you do not have an independent license. So I just wanted to review those definitions so that we're all on the same page. Moving on. All right, now what? So now you have to decide whether or not you would like to become an enrolled provider for Medicare, or if you'd like to opt out, which is generally what this little Zoominar is all about. If you do want to enroll, in case you're on the slides, just checking that out, you will register for an account in the INA management system on the cms.gov website. This website has all the information about Medicare, how to enroll, how to opt out, what the definitions of the providers are, what the definitions of the services are. So you may wind up finding yourself on the website anyway, but if you would like to enroll, you'll find that process there. You will need an MPI number if you're not already assigned one, and you will enroll through the PICO system. There is an alternative to manually hand in the form that you need to enroll, which, in case you're ever interested, is called the CMS 855I form online. However, this whole Zoominar is about what if I don't want to enroll, so let's do that now. If you do not have to enroll in Medicare, but you have to then opt out. In order to do so, you have to fill out an affidavit and submit it to the proper MAC, which is the shorthand for Medicare Administrative Contractor for our state. Now, there are different MACs for different states, and there's a long list of all of the MACs in the nation. You may not treat a patient with Medicare, even if one is privately paying you under a private contract, without opting out or in. So you can't really hang out in this in-between zone for too long. You may not opt out in one setting while opting in another. So what that means is that if you're practicing in more than one location, you cannot choose to opt out of providing services to Medicare individuals and then work somewhere else and opt in. So you have to choose one way or another. I'll show you in the language where that is. We'll talk about MACs in a minute. So what is in this affidavit form? So the affidavit form is very clear in the Medicare policy manual. So I've listed the policy number here for you, policy 40.9. It's on page 24 of this massive manual that is available online, and I've provided the link there for you. So the affidavit is a written statement and you must sign it, and it has to have in there a set number of statements that pertain to your opting out contract. And I will share that on my screen and we can review it together. So this is directly from the policy that I indicated in that previous slide. There it is, 40.9, requirements of the opt-out affidavit. Now, it does talk a little bit about the opt-out period, which I'll address in a couple minutes here. It also addresses that for emergency or urgent care coverage, even though you opt out, you may be eligible for providing services to Medicare individuals that fall under emergency care settings. This doesn't really apply for your standard private practice outpatient clinician, but just so that you know that language is in there for you to review. These are the requirements of a valid affidavit. It must be in writing. You must sign it. It has to include your full name, your address, telephone number, your NPI number, or a billing number if there's been one assigned to you. If you do not have an NPI, which most of us do, which you can find on the NEPPS website, if you don't have it already, you can also provide a tax identification number. It must state additionally that except for emergency or urgent care services, as I mentioned, during this opt-out period of time, you will provide services to Medicare beneficiaries only through private contracts for Medicare covered services. So you are not billing for Medicare. You're providing to beneficiaries any services that would normally be provided only through private contracts. The next line here is that you will not submit a claim to Medicare for any service furnished to a Medicare beneficiary during that period of time. And you will not allow anyone else to do so on your behalf. So if you're using a biller or something along those lines, no one on behalf of your practice will be submitting a claim for Medicare for any service furnished to a Medicare beneficiary during that opt-out period of time. This next line is similar. So it's stating that you understand that during the opt-out period, that you may not receive any direct or indirect Medicare payment for any service that you're providing to the Medicare beneficiaries during that time. So either directly, whether you tried to directly bill or indirectly received any sort of monies from a Medicare beneficiary, it cannot be from Medicare itself. Again, it's reiterating that you are only using a private contract. You will state also that if you're opting out of Medicare, you're acknowledging that during that time, that no payment may be made to any entity for those services. So not only can you not receive any sort of payment from Medicare during that time, but no one else can also receive payment for those services. The next line here states that you are bound by the terms of the affidavit that you're submitting here, and also that you're bound by the private contract that you are making and entering into with those Medicare beneficiaries. This next line is that you are recognizing that the terms of the affidavit that you're signing here apply to all Medicare covered items and services. So any CPT code that you're using, any services that you apply, those will all be covered under this opt-out affidavit. So you cannot provide any service of any kind, except for under private contract. So this next line identifies that if you've signed a Part B participation agreement, and that is the enrollment agreement, that if you then fill out this affidavit, the enrollment will terminate on the effective date of the affidavit. So this is important because if you work in another setting in which the company or the group has submitted on your behalf an enrollment, which you would know about, because you would have to sign it, and you did previously enroll for any reason in Medicare, once you sign an affidavit to opt out, all of the enrollment contracts are now null and void. The next line here states is the statement about emergency or urgent care services. Again, this may not apply to you, but it is the only circumstances in which you might be able to submit a claim for payment for emergency services if you've opted out. Okay. So ensuring that you properly identify yourself is the next line. So again, the affidavit asks you for your name, your address, your MPI. You're providing the most accurate information about the provider opting out to ensure that the Medicare contractor knows that you are the correct person that is not submitting any sort of claims or receiving payment during that time. And then additionally, this last line is that all of the information on this affidavit, including your signature and your agreement, will be filed with the MAC that has jurisdiction over our claims. If you see this last line here, it states that the affidavit is to be filed within 10 days after you sign your private contract with the Medicare beneficiary. This means that if you have a client that has come in and they do have Medicare and you have not yet either enrolled or opted out of Medicare, you have 10 days to fill out an affidavit and file it with the MAC. Otherwise, you will be out of compliance. I'll get to that again in a minute. So that is in the affidavit. Those are the lines that need to be in there. Again, you can find this here in the manual on page 24. How long is the opt-out period? So the opt-out period is 2 years from the date that you sign the affidavit. It will renew automatically. So once you have done one affidavit and signed it and submitted it, this will then opt out. I mean, the opt-out will continue every 2 years automatically unless you've asked them to do otherwise. Which means if you'd like to change this, if you'd like to enroll perhaps in Medicare, or if you want to retire or you're moving or whatever, you can submit a written request to the MAC at least 30 days prior to the renewal date. So you may want to take note of the date that you sign the affidavit and submit it in case you'd like to change your mind later down the line. So let's talk about the MACs for a minute. So these are the Medicare administrative contractors again. They will be different depending on the state that you're practicing in. If you do practice in more than one location, if you're licensed in different states and you provide services across the state lines, you must fill out an affidavit and submit one to every MAC that applies to you. So we do have the entire list here, a link to the list anyway. But just so that you know, in Massachusetts, we are using the National Government Services Incorporated, and I have here the address, the phone number, and their individual website. Do you have to build this yourself? No, there are affidavit forms that are already created by CMS that you can access. You can either ask your MAC for one, or conveniently, you can go to the website for our MAC and find the affidavit form, which I can actually show you now. Stop sharing that one, and I'll show you what that looks like. This is the website for our MAC, the National Government Services. Here on the left-hand side here, you will state that, yes, you're Part B. There's a drop-down menu. You're in Massachusetts, unless you're somewhere else. You'll press enter. And then here are a whole lot of information from our MAC. So there's an enrollment section here. If you want the affidavit form, you'll go to resources, forms, and then about halfway down the page, there's a little thing that says Medicare Opt Out affidavit. You can open that up, and this is what it looks like. So in there are all of the statements that we've gone over today, that are already in there for you, as well as all of the legal information that you have to include. A signature line, license information. Also, here we are, MHCs have now officially been added to this form. A few months ago, they were not, but they are now. And then this is where you're going to be sending that form to. So that is what it looks like. So no, you don't have to create your own. There already is one that you can use. Okay. All right, so I don't see Medicare patients one way or another. Do I have to do anything? We do highly recommend that you choose to opt in or opt out as soon as you can. There are circumstances in which you might find yourself with a Medicare covered individual and you didn't even know that they had Medicare, or perhaps during the course of your treatment with an individual, they need to become Medicare beneficiaries, right? And so upon knowing that, you will have 10 days to submit an opt-out affidavit at that point. So rather than put yourself in a position where you have to choose one way or another with a client on your caseload, it probably makes sense to make a decision and go ahead and submit an opt-out affidavit or enroll in Medicare, whichever it is that you choose, knowing that at any time you can change that choice. Right, so you can always change and submit to the MAC that you would like to end the opt-out, or you can always go back and after you've been a Medicare provider, you can then opt out later on. So that is our recommendation. And when you're not sure, I always say when in doubt, look it up. Of course, a lot of the Medicare procedures and forms and guides can be very weighty. The Medicare guide that I shared with you earlier is about 300 pages long. But if you're not really sure, make sure to go back to the actual source and look up the information for yourself so that you can have it right in front of you. Hopefully this is helpful. Definitely let us know how it goes. And if you're interested in more information about Medicare and you would like to see another little Zoominar about how to enroll, certainly give me feedback and we can see if we can make that happen. Thanks a lot.